Hi everyone, welcome back to my YouTube channel and today we are going to talk about posterior cranial fossa. So let's start our topic with introduction. Posterior cranial fossa is the deepest and largest of three cranial fossa. It lies behind the middle cranial fossa and it houses the cerebellum, pons and medulla oblongata. It also contains many important foramina through which cranial nerves and vessels pass. Boundaries of posterior cranial fossa. It has anterior boundary that is made by dorsum styli of sphenoid bone and superior border of petrous part of temporal bone. It has posterior boundary that is by internal surface of squamous part of occipital bone, and then it has floor that is formed by mainly by basilar part, condylar parts and squamous part of occipital bone, with contribution from the petrous and mastoid part of temporal bone is also there. Then there is roof of posterior cranial fossa, that is by tentorium cerebelli, that is a fold of dura mater that separates the posterior cranial fossa from the occipital lobes of the cerebrum. Important features of posterior cranial fossa. First, there is foramen magnum, that is the largest opening that is located centrally. It transmits medulla oblongata, meninges, vertebral arteries, spinal root of accessory nerve, and spinal arteries. Second feature is cleavage, that is a sloping surface formed by basilar part of occipital bone and body of sphenoid. It supports the pons and medulla oblongata. Third feature is internal occipital crest and protuberance. Internal occipital crest gives attachment to phalanx cerebelli. Internal occipital protuberance is the meeting point of major venous sinuses. Fourth feature is grooves for venous sinuses. There are grooves for transverse and sigmoid sinuses that are present on the posterior wall. Foramina and canals of posterior cranial fossa. It has foramen magnum that transmit medulla oblongata, meninges, vertebral arteries, and spinal root of accessory nerve. Second foramina here is jugular foramen that transmit ninth cranial nerve, that is glossopharyngeal nerve, 10th cranial nerve, that is vagus nerve, 11th cranial nerve, that is accessory nerve, and also internal jugular vein. Third foramen here is hypoglossal canal that transmits hypoglossal nerve, that is 12th cranial nerve. Fourth opening here is internal acoustic meatus that transmits 7th cranial nerve, that is facial nerve, and 8th cranial nerve, that is vestibulocochlear nerve, and it also transmits labyrinthine artery. Fifth foramen here is condylar canal that transmits emissary vein. Sixth is mastoid foramen that transmits emissary vein and meningeal branch of occipital artery. Contents of posterior cranial fossa. There are brain structures present in posterior cranial fossa that include cerebellum, pons, and medulla oblongata. Then there are cranial nerves in the posterior cranial fossa that include 6th cranial nerve, 7th, 8th, 9th, 10th cranial nerve, 11th cranial nerve, and 12th cranial nerve. Then in posterior cranial fossa there are blood vessels that include vertebral arteries, basilar artery, and dural venous sinuses. Then there are dural venous sinuses that include important dural venous sinuses in the posterior cranial fossa include sigmoid sinus, transverse sinus, and superior petrosal sinus and inferior petrosal sinus. Clinical significance of posterior cranial fossa. First is foramen magnum syndrome, that is tumors or herniation at foramen magnum that may compress medulla oblongata and it can cause respiratory failure or death. Second significance is acoustic neuroma, that is also called as vestibular schwannoma. It is tumor at the internal acoustic meatus and it compresses 7th and 8th cranial nerve and it can cause hearing loss and facial paralysis. Third significance is jugular foramen syndrome, that is also called as Werner syndrome. It is lesion at jugular foramen that affect 9th, that is glossopharyngeal nerve, 10th cranial nerve, that is vagus nerve, and 11th cranial nerve, that is accessory nerve, and it can cause dysphagia, hoarseness, weakness of sternocleidomastoid muscle and trapezius muscle. Fourth significance is posterior cranial fossa tumors that are common in children and may cause raised intracranial pressure, hydrocephalus, and cerebellar symptoms like ataxia and imbalance. Conclusion of this lecture video. Posterior cranial fossa is most spacious and clinically significant cranial compartment. It houses vital centers of life in brainstem and cerebellum, as well as cranial nerve number 6 to 12. Multiple foramina in its floor allow important neurovascular structures to pass, making it crucial for both normal physiology and clinical diagnosis. And this was all about posterior cranial fossa. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.